Welcome to Nursing Online Education. Today we are discuss about Qatar Prometric exam related questions and answers. The nurse evaluates that the simvastatin being administered to a client is effective when there is a reduction in options are INR, chest pain, triglycerides, blood pressure. And the answer is triglycerides. Which of the client's health problems leads the nurse to question an order for a beta blocker? Options are heart failure, hypertension, sinus tachycardia, coronary artery disease. The answer is heart failure. Next question. The nurse identifies that a client receiving chemotherapy has lost weight. Which is the best nursing intervention? Options are providing low carbohydrate meals, explaining effect of chemotherapy, encouraging the intake of large meals, administering ordered antiemetics before meals. And the answer is administering ordered antiemetics before meals. Next question is, the nurse should teach a client to withhold the prescribed digoxin if the client experiences options A, sinusitis, option B, chest pain, option C, blood vision, option D, increased urinary output. And the answer is blood vision. A client is receiving an anticoagulant for a pulmonary embolism. Which drug should the nurse instruct the client to avoid taking without speaking with the physician? Option A, ferrous sulfate. Option B, acetyl salicylic acid. Option C, isosuprene. Option D, chlorpromazine. And the answer is acetyl salicylic acid. The next question is, clients with the diagnosis of bipolar disorder manic episode most likely will exhibit signs of option A, passivity, option B, dysphoria, option C, anhedonia, option D, grandiosity. And the answer is grandiosity. Tissue plasminogen activator is to be administered to a client in the emergency department. Which is the priority nursing assessment? Option A, apical pulse rate. Option B, electrolyte levels. Option C, signs of bleeding. Option D, tissue compatibility. And the answer is signs of bleeding. A client receiving morphine is being monitored by the nurse for signs and symptoms of overdose. Check all that applies. Option: polyuria, lethargy, bradycardia, dilated pupils, slow respirations. The answers are lethargy, bradycardia, slow respirations. During an intake interview, the client relates experiencing overwhelming, irresistible attacks of sleep. Which sleep disorder does the nurse identify after this interview? Options are insomnia, narcolepsy, sleep apnea, sleep terror. And the answer is narcolepsy. A client has diagnosis of primary insomnia. Before assessing this client, the nurse recalls the numerous causes of this disorder. Select all that apply. Options are chronic stress, severe anxiety, generalized pain, excessive caffeine, chronic depression, environmental noise. And the answers are chronic stress, excessive caffeine, environmental noise. Cracked pot sound on percussion over hydrocephalus baby is called as. Options are Chadwick sign, Homan sign, Kerning sign, McEwen sign. And the answer is McEwen sign. Among the following signs and symptoms, which is indicative of increased ICP? Options are bradycardia, hypertension, tachypnea, decrease in systolic pressure. And the answer is bradycardia. The most important side effect of NSAIDs is. Options are constipation, hyperthermia, hematuria, feed intolerance. The answer is hematuria. Next, all of the following are the sign fluid volume deficit in an infant except. Options are low urine specific gravity, increased pulse rate, decreased blood pressure, sunken fontanelles. The answer is low urine specific gravity. Next, a child who is suffering from cyanotic disease is more comfortable in dash position. Options are high collars, knee chest, prone, supine. The answer is knee chest. Next, which among the following hormone helps in skeletal maturation of fetus? Options are testosterone, oxytocin, thyroxine, prolactin. The answer is thyroxine. Next, in bacterial meningitis, CSF reveals. Options are decreased cell count, elevated protein level, increased glucose, low spinal fluid pressure. The answer is elevated protein level. Next, short stature is a type of dash disorder. Option A, orthopedic. Option B, cardiac. Option C, metabolic. Option D, psychiatric. And the answer is metabolic. Next, when assessing a child with chronic hypoxia, nurse has to look for. Option A, clubbing of fingers. Option B, decreased RBC count. Option C, SpO2 greater than 90%. Option D, fluid intake. And the answer is clubbing of fingers. After the physician performs an amniotomy, the nurse's first action should be to assess the. Option A, degree of cervical dilation. Option B, fetal heart tones. Option C, client's vital signs. Option D, client's level of discomfort. The answer is fetal heart tones. Next, the elderly client is admitted to the emergency room. Which symptom is the client with a fractured hip most likely to exhibit? Option A, pain. Option B, disalignment. Option C, cool extremity. Option D, absence of pedal pulses. And the answer is disalignment. Next, the nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to Option A, lack of exercise. Option B, hormonal disturbances. Option C, lack of calcium. Option D, genetic predisposition. And the answer is hormonal disturbances.